I didn't.
Oh, sure. It was so fun and just such an honor to be on with a legend. So with Miss Shepherd. So thank you for the invitation.
Oh yeah, Peggy's amazing.
She
Maybe
is.
that's all right. Peggy and I were trading texts about you though, and singing your praise. So I'm sure your ears were burning at the same time. So I'm gonna go quickly on mute just to say hello to
Okay.
these folks, and I'll be
All
right back.
right. And we are now at time. So, all right. All right, so thank you all so much, those who have joined us today for the first event from the Shelby County, Tennessee Lead Prevention and Sustainability Commission. We are so excited to give a kickoff the day before Children's Environmental Health Day. This afternoon, we'll have an opportunity to engage with experts in the field as it relates to environmental health. We also have access to people who are outstanding leaders in government and really talk about strategies about how we can all just collaborate together and wrap our arms around our children to make sure that they are safe at school, safe at home, and safe in our communities. So for the first part of our program this afternoon, we are so honored and privileged to have the opportunity to hear remarks from Shelby County, Tennessee's Mayor, Lee Harris's Chief of Staff. Welcome, Chief Danielle Inez.
Thank you, Tracy. I'm Danielle Inez. Like she said, I'm Chief of Staff to Shelby County Mayor Lee Harris, and I am proud to work for the best municipal government agency in town, alongside a mayor who has integrity and courage and who is committed to supporting the public interest. And while Mayor Harris and I have worked on countless initiatives together over these last 2 years, nothing has been as straightforward, as clear of a need as the development of the Lead Prevention and Sustainability Commission. Latricia Adams brought the idea of this commission to us early in the administration, and I do mean early, y'all. I believe we were still appointing our division directors when she slid into my inbox telling me that it was past time for us to take action. And the Lead Prevention and Sustainability Commission was the very first legislative item that I took before the County Commission and had the opportunity to lobby them to support. And sometimes it's hard to move a legislative body to take action on a new idea, but in this case, it was very, very simple. We didn't just have a catchy goal of a hashtag lead-free Shelby. We had an explicit mission to eliminate lead from the water sources in our public schools by following the testing mandates that then Senator Lee Harris championed in the State House. And you guys, it is not uncommon for laws to be passed and then sit on a proverbial shelf. It takes pressure, and therefore it takes courage for the intent of new laws to be carried out. Latricia Adams isn't afraid of pressure, and she is not short on courage, but most importantly, she's got the right perspective. So it should come as no surprise that not only did we get to pass the Lead Prevention Commission, we also had every commissioner sign on as a co-sponsor and verbally offer their support for the historical record. And that's what happens when Trissy Adams sets out to get something done. So what are we really fighting for right now? Clean air, clean water, safe food, a healthy environment to support a child's development. This is basic stuff, folks. But in Black and Brown communities like Memphis, Tennessee, we're not getting the basics. Our children are not guaranteed access to the basics. And so here we are. We need people like Latricia Adams and Mayor Harris and Representative London Lamar and Councilwoman Michalyn Easter Thomas, who you guys will hear from later. We need champions like all of you to raise awareness about children's environmental health needs, their basic needs. And so that's why we're happy to join other communities around the country in honoring tomorrow, October 8th, as Children's Environmental Health Day in Shelby County. Today, we talk strategy and we set our game plan for going forward. But tomorrow, we get to work raising awareness and encouraging action that reflects our commitment to a healthy environment for our children. And until we have environmental justice for our children and families, we all need to be getting into some good trouble. Ms. Adams, thank you for your hard work in organizing this event on behalf of Shelby County. And thank you for leading this important discussion about children's environmental health. I look forward to today's dialogue.
Thank you so much for those warm words and encouragement. So grateful for your leadership. And she is, Chief Inez is absolutely right. I definitely started early and was really persistent with engaging with her. And I'm just so grateful for my fellow commission members here for the panel today. Ms. Sharon Hyde, who will introduce herself here in just a second, as well as Ms. Betsy Shockley, who have just been such a blessing from the start with this work to truly just bring together some of the work that Ms. Shockley and Sharon have been working on for this point, decades, really intersecting that area of expertise and bringing it to the forefront. So it definitely is a collaborative effort. And with that, we're going to go ahead and start with introductions from our esteemed panelists. So I will actually begin with one of our first panelists, Ms. Ruthanne Norton.
Well, thank you so much for having me today, and I am so proud of the great work that's happening in Memphis and Shelby County. I refer to it as my second home, and every time I'm down there, I'm sure it's going to become my first home. I'm just always convinced of that. But I am so glad to be here. I've been just delighted to see the great work of the Black Millennials for Flint in helping to lead so much of this effort. The city and the county could not be better partners. I don't think that we have a better partnership anywhere in the country, and we're so proud of the work of Cheryl Marsh and Sharon Hyde. And you know, when we launched our effort at GHHI in Memphis, I said what I had totally fallen in love with was the pride, the aspiration, and the civic engagement of the citizens of Memphis. And that has been truer and truer every day. I'm glad to join you here. I'm the president and CEO of GHHI, an organization that works to address the social determinants of health and health and racial equity by advancing healthy housing. We were founded in 1986 by 9 parents who, when we come to work every day, we are here to honor and advance their desire to break the link between unhealthy housing and unhealthy children. And we will be at it till we are done.
All right, thank you so much for that introduction. And I would be remiss to not mention that in addition to my role, again, I'm Latrice Adams. I didn't introduce myself. I actually have a nonprofit that focuses on lead eradication, specifically in those communities that are the most disproportionately impacted, which will be African American and Latinx communities. And with that nonprofit, Ruthanne and the Green and Healthy Homes Initiative actually awarded us with our first grant. So had it not been for the generous contribution from such a supportive organization, we wouldn't be able to still sustain our almost 5 years. So I definitely had to put that in there. So next, if we could have Representative London Lamar.
Thank you so much, Latricia. Hello, everyone. My name is State Representative London Lamar, and it's an honor and a privilege to be here with you all today on this panel. And I am really excited to be an advocate for eradicating lead in our children's schools. To me, protecting our children in the public education system is one of the things that I ran on and I'm committed to doing and have done as a legislator. I came into this role working with Latricia because we were pushing legislation together to combat lead levels in schools. As you know, Shelby County had a huge issue with lead waters, and that's the same issues that go on across the state of Tennessee. And so I'm looking forward to later on this conversation being to go in more detail about our legislation and why supporting initiatives such as this it's really important in my role as being a legislator.
Thank you so much. And I've had an opportunity to engage with a lot of legislators in my life, and I had such a seamless process and opportunity working with Representative Lamar. I wish that I could just replicate, sprinkle your glitter all across the country. So thank you so much for your leadership. And I'd now like to start with Betsy Shockley.
Okay, how do I make it come on to me?
You are there.
You're good.
Oh, okay. I'm Betsy Shockley. I have served as a public health crusader for the last 25 years here in Shelby County. I am the manager of the Childhood Lead Poisoning Prevention Programs, Healthy Homes, and HUD Lead-Based Paint Programs. I was very instrumental in developing the environmental testing protocols and the case management follow-up protocols. I was very much involved in the creation of that with the state. My certifications and accreditations include the Tennessee Lead-Based Paint Risk Assessor and Lead-Based Paint Inspector. I've also been a certified public drinking water sampler when I was working for the state of Maryland. So I kind of bring more of the environmental building science to the health department component as we manage the families that are affected with lead poisoning and link them up with the services that they need, which are normally outside of lead poisoning, maybe food or shelter or whatever that family needs to make that child be well is our goal and our focus here in this program.
Awesome. Thank you so much. And without further ado, if we could now have Mairi.Albertson.
Yes, thank you. Good afternoon, everyone. I'm Mairi.Albertson. I'm the Deputy Director of the City of Memphis Division of Housing and Community Development. We have had a lead paint hazard reduction grant program sent for over 25 years, including a very recently awarded one that we're very excited to implement. And I'm just so happy to be here today with very longtime partners and new partners.
Awesome. So this is such a wonderful group, and you know, it's by no mistake that it's a lot of powerful women that are part of this event today. You know, we definitely have some wonderful male leaders in the great county, Shelby County, but it is so refreshing to see so many amazing women who are dedicated to this work to support our children. So we're going to go ahead and get started with this wonderful panel. To all of our participants, I think I put into the message box into chat, there is something going on with Zoom because you know I had to do my research where the live stream is not functioning appropriately. However, this will be available post-event, so it is recording just fine. So if you had those who were engaged or preparing to engage via live stream, our sincerest apologies as technology didn't go as planned. So we're going to kick it off with the first question. So we are in the midst of one of the most challenging situations in our history with COVID-19. And along with the issue with COVID-19, there are other issues that parents and families should be aware of as it relates to children's environmental health, especially with spending more time at home. Could you all share some of the other issues surrounding environmental health, environmental hazards that parents who may be listening today, educators that may be listening today should also be aware of?
I'm happy to jump in to kick us off if you don't, if that's okay. And, you know, I think you raised something very important here, which is we are using housing as our shield for health to protect against COVID-19. But what we are also doing is over 30 million families across the country are living in unhealthy housing conditions that are being exacerbated by not only the constancy of being in their home, but for over 6 months, no attention being paid directly to essential maintenance practices and other things to keep their housing healthier. You know, lead-based paint is a serious concern to us. In states like New Jersey and Maryland, we have documented where testing has gone down, and I know we're going to talk about that, and lead levels have actually gone up, and we're starting to see more kids being chelated than we have in years. But we're also deeply concerned about asthma, respiratory issues, as we have more crowding in houses and families coming together, more indoor air quality issues. We're worried about the structural defects on trip and falls. And I worry deeply also about our seniors. I know we're talking about Children's Environmental Health Day, but grandparents matter. And extreme heat and extreme cold trigger respiratory illnesses in our kids, in our families, and in our seniors. And I'll start there on those things that people should be paying attention to: changing their filters, having fresh air come into the house when they can. Because we now know that COVID travels through air systems. CDC just put that back up on the website. It's an important thing to pay attention to, but also to avoid chipping paint, to think about leaks, and to be thinking about how they can work with the Department of Housing, Community Development, and others as we think about post-COVID, how we triage in the pent-up demand. So I'll stop there for others to chime in.
Well, I'll just say one of our biggest housing problems in Memphis is cost burden. And so when, you know, our citizens have a lack of affordable housing and high housing costs, that leads them to have to make decisions about that adversely impact their health. So I think as we can just continue to grow the resources to develop more affordable housing for all of our low and moderate income citizens, then that's, you know, one way we can keep trying to make that better.
Yes, and I also want to take the time to allow space for City of Memphis Councilwoman Michalyn Thomas to provide an introduction.
Afternoon, y'all. As you know, Murphy's Law is whatever can go wrong will, and we have seen that exacerbated every single day that we use technology. Can you all hear me well with these? Okay. They've been acting up all day. But I am on the Memphis City Council as well as a public school educator. And so when you think about environmental issues that kids and families and seniors and everybody that's at home are having, the main ones that were brought up by Ms. Norton, if you talk about asthma being exacerbated, that quality of air inside of a home, lack of outside, vitamin D, being able to just have the nudge to go outside and get that, but also mental health. I think we can add that in there as something that we need to tap into as we go on our 7th month inside, or in ramifications that we shouldn't be doing things as we normally did in March 2020. So just to add in there mental health, to put that on the radar. But definitely quality of drinking water in certain areas. Our schools definitely probably have lead in them. But sometimes that may be the most quality water source that a child has access to. Actually, a lot of things that go on in our public schools, whether they're up to par or not, are sometimes the only access that our children have. As far as our free health checkups that kids get at school, they don't have them this year. They don't have someone to come in and check their eyes and their ears for free because they got that done at school. So to just be thinking about how health problems that may not be seen directly now will definitely show up in a few months since we've been going through this virtual learning process.
Such an important issue. I think this, if I could, just to underscore, I think the mental health issues are incredibly important. And, you know, we are also putting people in family situations that may not be healthy for them in terms of domestic violence and other things that we have exacerbation. And now that the utility shutoffs moratorium is passed, we're looking at financial cliffs for families. I worry deeply about issues of displacement and making sure that we're thinking about what happens come January after eviction moratoriums. We've got utility shutoff moratoriums coming to us. I know that, there's a great focus in some of the Tennessee CARES Act dollars that are trying to, that I know Sharon and others are really at work trying to put this to use. And I know the city's got some efforts coming out of that as well. But we've got to be thinking about pent-up demand coming, but this issue of mental health has got to be part of healthy housing, I think.
Thank you so much for that. And just to kind of, it's not on script, but thinking about with spending more time at home, both adults and with our children, I wanted to circle back to Mari. Can you talk about things such as weatherization and other things that Shelby County residents and just in many other progressive cities and counties across the state and the country, things that they can think about to create a more safe environment within the home?
Well, definitely some of the items that Ruthanne mentioned at the beginning, just, very simple measures such as making sure your filters are changed as they should be, really impacts the air quality. We taking advantage of programs like our weatherization program and our lead housing program and the healthy homes measures. And I know on the Healthy Homes Partnership in Memphis, there's some great suggestions on their website as well, as to just kind of everyday things that people can do that really, are affordable. Not every, especially preventative measures, as we all know, are much, much low cost than waiting until there's a big problem.
Thank you so much for sharing that. I think that is really important, and it makes this space so makes me so happy to see this collaboration. A lot of times, government agencies, nonprofit organizations have wonderful programs that are available to its residents, but oftentimes they just don't know about it. So I think that it's really important to make sure that at every opportunity we are amplifying the resources that are available. And to everyone that is in attendance, we will send out an FAQ that will have links and other resources that may be shared this afternoon. We'll make sure that those are shared with all of the attendees. So we're going to shift a bit to our next question. So when we think about the call for more accountability and oversight. So for example, we think about the work that Representative Lamar has done as it relates to mandates for more rigid testing for lead and water in schools. We also have to take into consideration what some of those long-term solutions are. So when we think about long-term solutions that are efficient and really get to the core of eradicating lead poisoning in our communities, can you discuss what you believe some of those solutions to kind of get us to that Northern Star, what that would look like?
Thank you. Thank you. Can you hear me?
Yep, we can hear you.
Awesome. So for me, what that looks like is a collaborative effort between community members, government agencies, and elected officials. And we all have a stake in collectively eradicating lead in our schools and in our families' drinking waters. And what I mean by that is one going to take legislative efforts. It's going to take some sort of implementation of laws to hold school districts and folks accountable to providing safe and healthy quality drinking water. And so in my efforts with Latricia, she came to me and said, hey, the federal government is updating their lead rules, and the Tennessee is not up to code. And so with the help of Lee Harris, who passed a Senate bill when he was in the state Senate, I was able to pass a bill to amend his law to further the accountability requirements around lead testing in school. And so originally, his bill required periodic testing for schools that were created before 1988, and lead drinking waters had to be removed if they had 20 parts per billion. And then they had to notify the health department. Well, our piece of legislation was done was get the Department of Education in coordination with the Department of Health to come up with the statewide lead testing programs that local school districts can implement. And therefore, it will be a standardized lead testing program that can be used across the state that local school districts can implement. This piece of legislation also requires us to do biennial testing for any facility created before 1988 and periodic testing facilities created after 1988. This bill also requires us to include not only traditional public schools, but public charter schools and public daycare centers. And so any public institution that is pretty much geared and educating our students have to be held accountable and have be using this statewide lead testing program. Also, what this requires is if you now test over 15 parts per million with the first samples of drinking water coming from a faucet sitting overnight, you have to immediately remove that drinking source. You have to notify parents within 5 days, and you have to notify the Department of Health and the Department of Education within 24 hours. What this also requires is that you have to retest this building every year until all sources are under 15 parts per million. And then if you have been tested 15 parts per million or more, then you have to retest within 30 days. And so it's just tightening up some of the parameters we put around lead testing legislatively and codifying it so we can hold people accountable to ensuring we have safe drinking waters in our public school facilities. Also, it's going to have to continue for parents to continue to put pressure on their elected leaders to make sure that our government agencies are being held accountable to testing lead water and making sure we're continuing to tighten up parameters around lead drinking water. We also have to implement some sort of self-responsibility on this. We have to take it upon ourselves to not necessarily depend on our public school institutions and our government agencies to do that, although we should. We have to make sure we're educating ourselves in our homes, in our churches, in our community groups about the importance of having safe drinking water and continuing to make this sure that's a priority for our families and our children. And so together, we can all come together and hold everyone accountable to making sure everybody has a right to safe drinking water. This is more than just about a Memphis or Tennessee issue. This is a health issue. This is an environmental issue. This is a human right. And I expect us to come together and get it done.
Ooh, Representative, that was powerful.
Just say amen to that. I mean, can I get an amen on that? Because honestly, I want to say it's so important, but Delegate, if I could weigh in one thing, you will have our complete and full support of the full force of whatever we can bring to bring those levels down, because 15 parts per billion has no basis in science. And I now sit on the EPA Children's Environmental Health Task Force, and one of my goals is to keep us driving down. But even the EPA, under the current craziness in Washington, has said that has no scientific basis, and we need to move to 1, not 15. So as we move this forward, I think that's something that, from a diligence and vigilance standpoint, from community, from government, and thinking about this, and from healthcare, we have got to be thinking 1 or less rather than 15 over time. The first step is getting this really good bill in place. And the second piece is getting behind London Lamar here and moving the force of those levels down. Not only as you said in Tennessee, but across this nation. because we are knowingly poisoning children and teachers who are of childbearing years and adults. There is cardiac implications that come from adults drinking leaded water, and impact on kidneys and hypertension, the things that we've seen so long. So all praise to you on this work. And we just need to drive down the rates. We've got to do many, many things at scale now. We can't let this moment pass without scale, but that is amazing.
Thank you. And I want to, that's a good segue. Thank you so much for that follow-up, Ruthanne. I also want an opportunity to connect with Betsy. So Betsy has the wonderful privilege to work with our little ones who actually come in with parents to actually get screened. Can you tell us about your work and your program around childhood lead poisoning prevention, and just advice that you would give to parents, those who are thinking about becoming parents, around keeping their children lead safe, lead free?
Well, three things: good housekeeping, good hygiene, and good nutrition. With those three things in place, that we should have no more lead poisoning in Shelby County or anywhere in the nation. Nutrition plays a key factor. The more fatty foods a child eats, or if a child's stomach is empty, they're going to fastly absorb lead into their bloodstream. Housekeeping, making sure that that dust isn't available for your child to play in. Here in Shelby County, we have a lot of carpet, and I wish we could outlaw carpet, because carpet harbors so much dust. If a child is asthmatic, they're not living in a place that has carpet, but we keep putting carpet in houses, and it's very hard to keep a clean and dust-free environment for your child to play in when you have carpet. So smooth and cleanable floors is the way to go. And then the last is hygiene. Washing your child's face and hands, clipping their fingernails, making sure they're trimmed. Those three things alone really can dramatically reduce your child's lead poisoning if the child is living in a pre-78 home that may have some lead hazards.
Yes, thank you. And that's what makes lead prevention just so interesting, is that we know what the solutions are. So it's not like we have to do a ton of investment and research to try to understand what we should do to mitigate exposure to lead. We know what the solutions are, and I think that very much so, connecting back to what both Representative Lamar and Ruthanne talked about, is just really putting a fire under all of those who have a stake in this work, all of those who are part of the decision-making process, to finally get this done and eradicate the exposure. I want to connect with Sharon. While Betsy very much so engages with our family and with our children, the work and the programming that Sharon manages also very much so has a direct impact on families throughout the county. Can you speak a little bit more to the work that you do?
Sure, and I'm Sharon Hyde. I am with Green and Healthy Homes, our project manager here. We have the Healthy Housing Partnership, which is bringing agencies together to discuss how we can make families' houses not just affordable, but safe and healthy. So one program that we have here is our Master Home Environmentalist program, as well as our relationship with Lobato Children's Hospital, where any of their Nurse Family Partnership and Healthy America's family programs can refer clients to us, their nurses and their health workers, and we do an in-home assessment to identify lead hazards, asthma triggers, any kind of indoor and outdoor hazard. And then we work with partners like Mairi at HCD, their Weatherization program, their lead program, as well as MLGNW for energy audits, to make sure these houses have all of the opportunities and referrals to be safe and healthy. We also give all of our clients a green cleaning healthy supply kit, which has how to use effectively vinegar and borax or baking soda instead of some of the chemicals people are using to clean their homes, and teach them about lead dust, about asthma triggers, about washing their bed covers, preventing the children's bedrooms from having bookshelves and stuffed animals that the dust harbors in. And then, like Betsy says, they play with that stuffed animal, get the lead dust on their hands, put it into their mouth. We have some healthy food item kits we give them. And along with that, we give them some of the outreach materials on a healthy diet to prevent lead poisoning and prevention. So we're also working now with the school health at Le Bonheur. They've got, I believe, 9 nurses in some of the high-risk areas. And we have worked with them to give them protocol of what their nurses need to ask the children and the parents about. Is their house built before 1978? That it is important to get their child tested by their pediatric. Even though people are scared right now to go to the doctor, we want to make sure these nurses have these relationships with these students and the parents to get them into the doctor to get their blood tested now. So we're working really hard here. I want to thank Ruthanne for having me at GHHI. My background is in lead. Betsy and I have been working together for 27 years, and thank everyone on County Commission for also putting me on the Lead Sustainability Commission so we can all work together.
So I was right on when I said decades, so plural. That is just amazing, the effort. I just want to give you just a round of applause. It's a hard job, and I am just so grateful for you all. Before we transition to the next question, I did want to get a little bit of input from both Councilwoman Easter Thomas from a perspective of both a council member as well as an educator. And isn't that a phenomenal combination? It's rare in this day and age, so really exciting to have your expertise. And I also like to hear the perspective from the programming that you work with, Mari, with the city of Memphis as it relates to programming and community development. How can we make sure that we use the resources that we fight to get access to? How do we make sure that it has those outcomes that we wish to see?
Well,
Okay, I'll
Latricia,
start. Or I'll
okay,
let
you can go.
Councilwoman go ahead.
Oh, you can go ahead. I'm sorry.
Okay, well, you know, I'll agree what the speakers before me were saying. I mean, really, you know, prevention before exposure to lead hazards is key. So accessing resources through our lead program, as well as the one, you know, the programs through the county, and removing those hazards from the environment, and then testing and follow up with the families that we work with, is really important, because removing the hazards is really what's going to help lead to preventing future occurrences. You know, if we get it out of a rental unit now, a future family moving into that unit isn't going to come into contact with the lead hazard. So I think that's what's really important about the lead programs in our community in terms of just permanent removal of the hazards. And then we also have other resources that we can implement in terms of healthy housing. I guess last year we were successful in getting started and implementing and awarding funds through our Affordable Housing Trust Fund. And that was a really exciting advancement in affordable housing, because it's a sustainable resource, and it's not a federal grant, so it doesn't have some of the restrictions that much of our federal funding has through U.S. Department of Housing and Urban Development. So we are able to do more and have more flexibility as we, you know, encounter obstacles through these programs. We're able to adjust a little more quickly than we could. The first round of the trust fund programming was focused on rehabilitation, which we know is a huge need in our community. very closely related to healthy housing. So if we can assist units through their rehab programs, and hopefully build future programs as well, I think that's going to be really important. And then in terms of measurement of success, probably the best way that we do that is in our grants. We do set benchmarks, and we have been hitting our mark or exceeding our mark on those benchmarks. So, you know, there's only so many units we can do with each grant, but each tranche gets us a little closer to getting rid of these issues in our community.
Thank you for that, Mari. And I'll be the first to say, while I am a native Memphian, I have spent time living in multiple places, but in my experience, the collaboration with the city of Memphis, and then also with Shelby County, with working with the community to, one, do joint applications for grants is something that I had never seen before until I moved back home. That is so powerful. And just having that community input combined with the expertise from a government agency really is how you can get the work done. So I just wanted to commend the city of Memphis for that collaboration, and then of course as well as the county. And so I'd love to hear your feedback, Councilwoman and educator Easter Thomas.
Thank you, Mara, for saying all of that. I think that kind of shed light on possibilities on what local government has the ability to do. But I want to bring focus to the fact that a lot of times, to use this analogy, when you open a box of problems, you have to be ready to fix them, right? So I think a lot of time in local bureaucracies, we get to a point of where we keep the box closed and out of the way and in the corner, so that we don't have to immediately be able to remedy those issues. And I think that this is one of them. What I would like to see is, I know that Shelby County schools have been tested. However, I would like to see city buildings, community centers, libraries, and those that all of our people use as well, tested as well. And I have brought this up to code and to engineering and to general services with in mind the analogy I just used. So if you're thinking about solutions is at the same time that you're thinking of a possible issue coming forth. So it's going to take probable joint grants and joint thinking and suggestions and working together to try to see how will we be able to remedy these problems, because we know once we start testing these buildings, they're going to come forth. So how are we going to remove these hazards? Because that's going to be the only way. Remove and replace. It's going to be hard to fix certain things. So we just have to think about how will we be able to fund removing and replacing certain areas, and then what are our priority areas? So where would we start when we're looking at the landscape of the city of Memphis? But I would definitely like to see in the coming year a plan and a start to testing our city buildings for lead. So at least that we can get a starting point of where we have to move from. And that's not me calling anybody out, because I already brought it up to different divisions. So I'm not nitpicking on anybody. It's just me putting it out there again.
Right, like let's get a disclaimer. And I really appreciate you bringing that to the forefront. I definitely think, the first step with examining the water in our schools. And I will say that there has been a long-standing policy in the state of Tennessee, as well as statute, as it relates to lead paint in schools, that's under control. I will say that. But our children, our families also engage in other places in public spaces within the county and within the city. So that is very important. I will say that one of the most successful things that I did, and the first thing that I did working in political advocacy, was I actually helped to right, and get a bill passed in our nation's capital, so in the District of Columbia, where it is a bill that not only focuses on lead prevention and mitigation in public schools, but it also includes public facilities. So it includes things like city-specific community centers. It also includes public libraries, because those are also places where our children especially frequent. So we might be in COVID right now, but trust and believe, when outside opens up again, our families, our children will definitely be in those spaces, probably more than ever. So Councilwoman Easter Thomas, thank you so much for keeping that on the forefront and taking it into consideration. Please consider the LPC as being a soundboard and a thought partner as we move toward progress with just testing, learning about it first. And I think that's also really important to mention before we transition to the next question, is that we know the lead is there. We know it's there. And so I think what's really important as we start to peel back the layers, pun intended, is to not be afraid of the outcome, but just be prepared to fix it. It's not a finger pointing game, right? So it's not necessarily anybody who was alive right now. It's not our fault, right? But where we are at fault is if we know that it exists and we don't do something about it. But the first part is to know. So I think that just kind of changing the culture around testing is really, really critical, because it's scary. You know, especially when those numbers came out with schools last academic school year, that was intense, right? So you had parents that were panicking, you had you had school officials who were terrified. But the first thing is to know. And Tennessee is one of less than 15 states that even have bills in place that even test. So definitely wanted to mention that. So I want to actually segue to a very important piece. So circling back to our nemesis, COVID. So with COVID, there's been a national decline as it relates to testing, specifically for lead screenings. Of course, like, people are still scared. We've even seen a decline in mandatory immunizations for children as well, just because people are just afraid to go out into public. And it's just really difficult to social distance and put your mask on. If you got babies, you got to make sure that they have their mask on. So lots of circumstances that has attributed to the decline with testing. While I get Betsy to kind of speak more to this current phenomenon, I actually want to display an actual map that shows where we currently stand within Shelby County. So Betsy, if you could kind of share just some insight on what is happening. And then again, I want to leave people with strategy. So advice, not just to parents, but also to community leaders about what we can do. What can we do on our part to encourage parents to get their children tested?
COVID-19 definitely has had a major effect on public health, from immunizations and lead screenings to diagnostics to going to the doctor because you're not feeling well. People are not doing that. So this map that's in front of you was put together by the state of Tennessee. They are currently tracking how COVID-19 is impacting public health on a whole. So this is for lead. They're looking at statistics for TB, for STDs, for all of the major trackable diseases that we have here in public health. So as you can see, our screening rates are down, but they are down because people are afraid to leave their homes. We are in phone contact with our patients Some of them were due to be tested in April or March. They don't want to go to their primary care physician. We call them on the phone. We keep in contact with them to make sure that, you know, if they need any services, hopefully they will get back in and have that child retested. Last month, we did see an upsurge in screenings. However, this map doesn't reflect that because the data hasn't hit yet. But we did have a fairly large amount, larger than average amount of children test positive last month. So that shows me that they are starting to go back to their primary care physicians and receive screenings. But COVID not only will impact lead, it's going to impact from mental health to environmental health. Time will let us know what the true impact will be.
Yes, so thank you for sharing that. I know when Betsy shared that with me earlier, it's like, you know what, we had seen, CNN had actually released a story a few weeks back that talked about the decline, but to physically see it just really is eye-opening. And I thank you for sharing that. I know many people who are on today just didn't know. So that's why I'm glad that there's diversity with the panel and with the viewers this afternoon, so that you can encourage those folks that you know that have children to just go get tested. It's the health department, so they're going to be practicing all of all of the safety precautions to make sure that you're safe. I know I had to be brave and make sure that I went to go get my physical, because, you know, you just got to do it. I slapped that mask on. I put some gloves on too, you know, just in case, you know, so I thank you for providing that encouragement and that push to our parents. We have time for just one more question, and I do want to open it up to any of our attendees for questions that they may have. I do know that we have one question that came in. So I actually want to connect this question to Ruthanne. So Ruthanne is super fancy, and she had an opportunity to co-write a article that appeared in the Yale Journal of Health Policy, Law, and Ethics, and it talked about health justice strategies to eradicate lead poisoning. So we kind of alluded to this a little bit earlier, but we know what to do, right? We know exactly what to do to fix this issue, but we just got to do it, right? We want to make sure that we do not see this for generation to generation. So Ruthanne, can you kind of share some of the research that you had in that process in writing this stellar article?
Well, it's 66 pages, so if you can't sleep at night, I totally recommend it to you. And but really smart people that allowed me to join with them, and thank you for raising it. I want to, before I start this, I want to, you know, you talked about we can't point fingers. We inherited this issue, right? And I think we cannot pass the moment to say that this is all tied into unjust and ill-conceived housing policies that at its heart also, in my view, had race embedded in that. In 1921, let's not forget, the United States was the only country that didn't sign the ban on residential lead-based paint around the world. In 1937, the United States put out its first uniform housing code standards that it called for, and for health and safety. But in 1938, mandated the use of lead-based paint in low-income neighborhoods. So that's what we have inherited as we move forward in how we look at source eradication through lead pipes. But in inspiration, I want to talk about Chicago just announced they're going to replace their leaded pipes. The state of New Jersey has an entire plan about doing this. Milwaukee, Lansing, Michigan. It can be done, and especially must be done in schools. We do not send our kids to school to be poisoned. We send them to learn. If they are getting poisoned at school, they cannot learn And in all praise for teachers, I saw our teacher just came back on, and one of our two here, and we have to not give up on that. In housing, what we know is now is the time. It is the inflection point in this country where we have to pivot as a country. Scale matters. We have to be looking at income tax credits for those who will invest in housing. We have to look at scale in the programs to equip our housing directors and health directors to work together on this. We need to think about mobile testing technology at a greater scale. COVID shows us that. People are afraid to go out. So we're going to have to start to go to them more. And we have to get rid of barriers. That one program doesn't allow you to replace windows and another does allow you to replace windows. When the windows are leaded, when they're causing mold, mildew, and moisture, we have to align all of our public programs to some common sense. Kids, if you're on WIC, if you're in Medicaid, you should qualify across the board on things that will make your housing healthier and not spend our government people through pretzels and everybody else trying to fit people in square pegs into round holes. We have to have uniform access to programs and help them work together. On a weatherization program, 60% of the time across the country, an application will be deferred and declined because of mold, mildew, moisture, lead. That declination or deferral costs thousands of dollars and means that we will never complete the job. Completing the job is our way to health and racial equity. It is our way to housing stability. It is our way that every kid gets in the classroom healthy, ready to learn and to succeed. We are better when every child can exceed grade level reading, and bar none, we are all better for that. So there's so many important programs that are happening in how housing courts can play into this and help propel, how we can use all those intersections where there is contention as also opportunities to educate. One thing we learned in our 99% reduction in lead poisoning in Baltimore, major things. One, property owners are better off economically, stability-wise, when they lower lead hazards in those properties they own. And they may have, grouse about it in the beginning, but in Maryland, that 99% reduction was paid for by property owners, and they now are our ambassadors in this. It also is important in intergenerational wealth transfer. Toxic housing will never be as valuable. And one of the things that has been clear, if I may, on white privilege, has been the white community has built wealth over time in real estate and property, that our policies have deterred and undermined other communities from that, making housing healthy that can be transferred. Of value is an important bedrock of building opportunity. And so we have to weave together all of our programs, have to have a health standard in our housing standard. So weatherization, home repair, lead. You've got phenomenal people in Mairi and in Paul Young that is amazing that other communities do not have. And we need to lift and support them and their drive to do the right thing in all of this, but it has to be source control. And I was thinking about other places. We have to think about the water fountains that are in parks. To test them, right? We have to think about those picnic benches in parks that people go to that are often painted with lead. We have to think about churches that we often protect from having to do things sometimes, or we all feel safe because we're going to church. But church is a place where a lot of kids spend time, a lot of families spend time. We need to help them and the child care centers they run, as well as the licensed child care centers. And we need to think about how child care is conducted, because it'd be great if it was all in certified child care centers, but it's homes, it's aunts, uncles, grandparents. And we have to be realistic about funding those opportunities in social care. And then the last thing I will say, big learning, is healthcare is a big part of this. There's a thing called a hospital community benefit fund. Every nonprofit hospital, and all praise to Lamar, what a great partner they are. But throughout the state of Tennessee and throughout this country, nonprofit hospitals have to invest in community to reduce chronic illnesses by hospital community benefit investments. That is not done well by our hospital systems, can be done really well. We have a hospital system in Pennsylvania that just put $50 million for lead eradication into a town of 90,000 people. Think about that. If they can aspire in Memphis and in Shelby County, we can aspire to that. Medicaid managed care is now focused on outcomes. What better outcome than people are healthy, kids can get to school, they can read, there's housing stability, parents can go to work, people are doing better. So I think we have to really think about healthcare dollars, utility dollars better aligned with healthcare dollars to help pay. And everyone who's a home visitor should be a Healthy Homes ambassador who can report a defect, who can help educate a family. Earlier we get in, the better. And I will just leave us with one thing that we know. There is one cure and only one cure for lead prevention. So your app ought to be in everybody's hands. It is a phenomenal app that Black Millennials for Flint has developed that empowers people to get data, to go then be referred for resources and action. But it's action that matters. What we are all on this call paid to do and called to do is in service to ensure the most amount of money, the most amount of resources, and the most amount of action for good happens in the homes of the people we serve. It's what we are doing. It's why we show up every day. And we have got to not shy away from scale. I had a question asked of me by Johns Hopkins the other day. We were talking about Baltimore. We're talking about investing in East Baltimore. And Alicia Wilson, who has joined Hopkins and is doing so much on health and racial equity for them, said, Ruthanne, you're talking about a couple of million here and a couple of million there. We want to know what it costs. We need to know what it costs so we can plan, invest for that. And I think all of us, no matter who we are, have to look at what it actually will cost, and we have to build all of our bridges, all of our programs to solve for that, because we have a lot of making up to do. So let's do it, starting with Children's Environmental Health Day. Let's do it in Memphis. Let's rock the world. Let's show them what we can do. And, you know, I just think that we have to build, because if we want teachers to be successful, we want kids to be successful in the classroom, where a child lays their head down at night, child has to be able to breathe to get not have asthma. We can't damage their brains. And when we do that, and we care for our seniors about where they live, this world will actually be a better place. So I'm so honored to be with you. I wish I could be with you every day, but I'm so glad to connect. And thank you for allowing me. Please read the paper, and lots of really important people like Mona Hanna Atisha, Emily Bedford, and others. And look, we will be putting out a lot of publications. Last thing coming out, and I invite you all to partner with us on this. How do we measure our health impact, our racial equity impact, our opportunity impact through housing? I think it's the pathway to our mutual success.
That was powerful. And thank you. Everybody stuck with us because we're a little bit over time. Again, no, don't apologize. We need these gems. So again, Thank you all so much for sharing your wealth of knowledge. It was just so outstanding to have so many multiple perspectives. I would not be Latricia Adams if I did not have a call to action before we leave this place. So one of the goals that we're striving for with the Lead Prevention Commission, and I do have to give ourselves a pat on the back, that we accomplished our goals in our first year. We got a whole bill passed with Representative Lamar. So when we talk about community organizing, I really think that the work of this commission has done just that. And so as we move into the next year, we actually were a year old. In September is when we actually were installed. We want to talk about environmental justice and really putting money into the hands of the people who are working on the ground to ensure that communities are safe. So be on the lookout. I'm looking at our legislators on the panel today as we talk about ways to really get to that Northern Star, to really get to lead-free communities, which of course just starts with prevention. So thank you all so much. We'll be sure to share FAQ with all the attendees today with the gems and wonderful resources that were shared. And you all have a phenomenal rest of the day. Thank you all so much.
By the way,
Thank you for putting this
Lamar,
all together.
Hollywood name.